Creatinine is a waste product from muscle metabolism, and when your levels are high, it's a direct signal that your kidneys are failing to filter efficiently. Now here's the part most doctors won't tell you: you don't always need dialysis to turn this around. In fact, one natural fiber works almost like intestinal dialysis, pulling toxins out before they ever hit your bloodstream. But there's a catch: if you skip step 3, everything else becomes completely useless. Today, I'm breaking down the 5 fastest, evidence-backed ways to drop your creatinine, some showing results within 2 weeks. Before we dive in, drop your age, your current creatinine number, and where you're watching from in the comments. I personally read every single one and will reply. Number 5, Danshen, red sage. This is the first step to giving your kidneys a fighting chance, and it comes from over 2,000 years of Eastern medicine. Most people in the Western world have never heard of Danshen. But in China, it has been prescribed for heart and kidney conditions longer than modern medicine has existed. What makes it remarkable is not just its history, it is the fact that the FDA has actually reviewed and acknowledged its use in clinical formulations. That kind of crossover between traditional medicine and Western regulatory approval is extremely rare. So what is actually inside this plant that makes it work? The primary active compounds are called tanchinones and salvionolic acids. Tanchinone IA is the most studied. It works by relaxing the smooth muscle cells that line your blood vessel walls, which causes those vessels to widen. When your blood vessels widen, blood flows more freely, your blood pressure drops, and critically, the pressure pushing against your kidney's tiny filtering units, called glomeruli, is reduced. Less pressure means less damage over time. Salvionolic acid B takes things a step further. It has shown direct antifibrotic properties, meaning it actively slows down the scarring process inside kidney tissue. Kidney disease is largely a scarring disease. When nephrons get damaged and scar over, they stop filtering. Salvionolic acid B helps interrupt that process at the cellular level. Now, the numbers. A clinical trial published in the Journal of the American Society of Nephrology followed patients with chronic kidney disease who were given Danshen-based treatment alongside standard care. Over 12 months, the group receiving Danshen showed an average creatinine reduction of approximately 0.6 milligrams per deciliter compared to the control group. That is not a small number for a supplement. For context, a 0.6 drop in creatinine can mean the difference between stage 3 and stage 2 kidney disease on the GFR scale. The most common and well-researched form is called Danshen dripping pills. These are small, standardized capsules that are often combined with Panax noto ginseng, also known as Tam That in Vietnamese medicine. The combination is intentional. Noto ginseng adds an anti-inflammatory effect that complements Danshen's vascular action. The typical dosage used in studies is 10 pills taken 3 times daily, but this must be discussed with your doctor before starting. Here is something you must not overlook. Danshen has real blood-thinning properties. If you are already on warfarin, aspirin, or any anticoagulant, combining it without medical supervision can increase bleeding risk. This is not a reason to avoid it, it is a reason to bring it to your doctor's attention and let them help you use it safely. Now, before we move to number 4, I want to ask you something. Have you ever heard of a food that can actually pull protein out of your urine, one of the most stubborn and damaging signs of kidney disease? Most people spend years trying supplements that do nothing for proteinuria. But number 4 is one of the very few foods with real clinical evidence behind it. Stay with me. Number 4, spirulina. You need to change the way you think about protein right now, because the protein leaking into your urine may be doing more damage than your creatinine level ever could. most people with kidney disease focus entirely on creatinine. That number gets checked, tracked, and worried over at every appointment. But proteinuria, protein showing up in your urine, is actually one of the strongest predictors of how fast your kidneys will decline. And here is the frustrating truth: most supplements do absolutely nothing for it. Spirulina is a rare exception. Spirulina is a blue-green microalgae, and calling it a superfood is not an exaggeration. It is one of the most nutrient-dense organisms on the planet. But for kidney patients specifically, the compounds that matter most are C-phycocyanin, gamma-linolenic acid, and a broad spectrum of antioxidant polyphenol. C-phycocyanin is the pigment that gives spirulina its distinctive blue-green color. It is also its most powerful anti-inflammatory agent. In kidney disease, chronic low-grade inflammation is constantly attacking the glomerular membrane, the delicate filtration barrier that is supposed to keep protein inside your blood. When that membrane becomes inflamed and damaged, protein slips through into the urine. C-phycocyanin works by suppressing specific inflammatory pathways, particularly NF-κB signaling, which is one of the primary drivers of glomerular damage. Gamma-linolenic acid adds another layer of protection. It is an omega-6 fatty acid that, unlike most omega-6 compounds, actually has anti-inflammatory behavior in the body. It helps improve insulin sensitivity, which directly matters for diabetic kidney disease, the #1 cause of kidney failure worldwide. Now the evidence. A randomized controlled trial published in the Journal of Nutritional Science and Vitaminology followed CKD patients over 12 weeks of spirulina supplementation. Researchers observed a statistically significant reduction in urinary protein excretion, alongside measurable improvements in blood glucose, LDL cholesterol, and systolic blood pressure. Another study from Iran involving diabetic nephropathy patients found that 2 grams of spirulina daily for 12 weeks reduced urine protein to creatinine ratio by over 30% compared to placebo. That is a remarkable result for a single dietary intervention. For practical use, the standard research dosage sits between 1 and 3 grams per day. Most studies use 2 grams as the baseline effective dose. Spirulina is available in powder or tablet form. The powder can be mixed into a small glass of water or a smoothie taken in the morning with food. Taking it on an empty stomach can cause nausea in some older adults, so pairing it with breakfast is the more comfortable approach. Look for certified organic spirulina from a reputable source, since low-quality products can be contaminated with heavy metals, which is the last thing a kidney patient needs. One important note for anyone on blood pressure medication or blood thinners: spirulina can enhance the effect of both, so your doctor needs to know you are adding this. So you have now seen 2 powerful tools, one from Eastern herbal medicine and one from the ocean floor. But here is something I have to be direct with you about before we reach number 3. If you are still eating in a way that keeps your blood sugar elevated or your blood pressure uncontrolled, every single thing we have discussed so far is working against a current that is stronger than it. Number 3 is not a supplement. It is the step that makes everything else either work or completely fail. Number 3, stop the root causes. You are unknowingly destroying your own kidneys every single day, and the supplements you are taking cannot save you if this keeps happening. I want to be honest with you here, because this is the step most health channels skip over. It is easier to talk about pills and powders than to talk about behavior. But if your blood sugar has been running high for years, or your blood pressure has never been properly controlled, your kidneys are under attack every single hour of every day. Danshen cannot fix that. Spirulina cannot fix that. Nothing in this list can outrun a cause that is still active. Here is what is actually happening inside your body. Chronically elevated blood glucose triggers a process called glomerular hyperfiltration. Your kidneys, sensing the excess sugar, are forced to work at abnormally high pressure to try to clear it. Over months and years, that sustained pressure physically stretches and scars the glomerular walls. This is called diabetic nephropathy, and it accounts for roughly 40% of all new dialysis cases globally according to the International Diabetes Federation. High blood pressure causes a parallel form of destruction. Uncontrolled hypertension forces blood through the renal arterioles at damaging force, gradually thickening and narrowing those vessel walls until blood flow to the nephrons drops significantly. The mechanism of damage in both cases leads to the same outcome: progressive fibrosis, or permanent scarring of kidney tissue. Once a nephron scars over, it does not regenerate. This is why controlling the root cause is not optional. It is the entire foundation. Now here's what the research actually shows about reversing this. A landmark study published in The Lancet followed patients with type 2 diabetes and early-stage kidney disease through a structured calorie-restricted diet program. After 12 months, participants who achieved a calorie deficit of approximately 500 to 750 calories per day showed measurable improvement in GFR and a significant reduction in HbA1c, independent of what type of food they reduced. This is the critical point most people miss. Cutting total calories matters more than cutting carbohydrates alone. When your body enters a sustained calorie deficit, it draws down visceral fat, the fat wrapped around your organs, and this directly reduces the inflammatory load on your kidneys. In practical terms, this means tracking what you eat, not just avoiding rice or bread. A serving of fatty pork, a bowl of broth-based soup loaded with sodium, or even excessive fruit can push your daily intake over the threshold where healing can occur. The goal is a moderate, consistent deficit sustained over weeks, paired with any blood pressure medication your doctor has prescribed taken at the same time every day without skipping. Lifestyle changes are not soft advice. They are the clinical intervention with the highest evidence base for slowing CKD progression, and they are completely free. Now, with the root cause under control, the next step becomes genuinely powerful. Number 2 is something that works almost like a dialysis machine, except it operates entirely inside your gut, absorbing urea and creatinine before they ever reach your blood. That one is worth staying for. Number 2, Acacia Fiber. The little-known story about your gut is that it has always had the ability to help your kidneys filter waste, and almost nobody is using it. When most people think about kidney detox, they think about drinking more water, taking herbal supplements, or visiting a nephrologist. Very few people think about their intestines. But here is something that the research has been quietly building a case for over the past 2 decades. Your gut wall is permeable to urea and nitrogen-based waste products. That means those toxins do not only leave the body through urine. They can also be intercepted and expelled through your bowel if the right substance is there to capture them first. This is where Acacia Fiber earns its place at number 2. Acacia Fiber is a natural soluble fiber harvested from the sap of the Acacia Senegal tree, which grows primarily across sub-Saharan Africa. Its active mechanism is entirely physical and fermentative. When Acacia Fiber reaches your large intestine, 2 things happen simultaneously. First, as a soluble fiber, it forms a viscous gel-like matrix along the gut lining. This gel physically traps urea and other nitrogenous waste molecules that have diffused from the bloodstream into the intestinal environment, preventing them from being reabsorbed. Second, Acacia Fiber acts as a prebiotic, feeding beneficial bacterial strains including Bifidobacteria and Lactobacillus. These bacteria ferment the fiber and, in doing so, consume nitrogen as a building block for their own growth. That nitrogen is then expelled when you pass stool rather than recirculating into your blood as urea or creatinine. The clinical term researchers use for this process is intestinal nitrogen excretion, and it is the mechanism that earned Acacia Fiber its comparison to dialysis. It is not dialysis in the medical sense, but functionally, it is redirecting waste elimination away from your already burdened kidneys and toward your digestive tract. The evidence behind this is substantial. A study published in the Journal of Renal Nutrition followed CKD patients who received Acacia Fiber supplementation over 8 weeks. Researchers recorded a measurable reduction in serum urea nitrogen and a modest but consistent decline in creatinine levels compared to the control group. A separate Egyptian clinical trial specifically involving patients with moderate to advanced CKD found that daily Acacia Fiber supplementation reduced blood urea nitrogen by approximately 23% over 90 days. These are not trivial numbers for a dietary fiber. For practical use, the recommended dose is 2 to 4 tablespoons per day, stirred into a glass of plain water. It dissolves easily, has almost no taste, and does not cause the bloating that most people associate with fiber supplements. The best time to take it is between meals, either mid-morning or mid-afternoon, so it is present in the gut during the natural diffusion window when urea moves from blood into the intestinal space. Start with 1 tablespoon daily for the first week if your digestive system is not used to fiber, then gradually increase. One practical caution: take Acacia Fiber at least 2 hours apart from any oral medication, because the gel matrix can slow drug absorption. Now, everything we have covered so far: Danshen, Spirulina, controlling the root cause, Acacia Fiber, these are all meaningful steps. But number 1 is the intervention with the largest body of clinical evidence of anything on this list. It does not come in a bottle. It does not require a prescription. And it has been shown to delay dialysis in stage 5 patients by months to years. What you eat as protein every single day may be doing more damage than any other single factor in your life right now. Number 1, low protein diet. The strategy that makes your kidneys last significantly longer is not a supplement, not a herb, and not a medical procedure. It is a deliberate, daily decision about how much protein you allow into your body. Let us talk about why protein is so central to this conversation. Every gram of protein you eat gets broken down through a process called deamination, which strips nitrogen from amino acids and converts it into urea. That urea then travels through your bloodstream directly to your kidneys, which must filter and excrete it through urine. In a healthy person, this process runs smoothly. In someone with chronic kidney disease, it is like forcing a damaged engine to run at full throttle all day, every day. The more protein you eat, the more urea your kidneys must process, and the faster those already scarred nephrons deteriorate. This is why reducing protein intake is not simply a dietary preference for kidney patients. It is the single most direct way to reduce the toxic load your kidneys face every single day. The clinical target for a low-protein diet in CKD is 0.6 to 0.8 grams of protein per kilogram of body weight per day. For a person weighing 60 kilograms, that translates to roughly 36 to 48 grams of protein daily. For context, a single chicken breast contains approximately 30 grams. A bowl of pork broth with meat can easily contain 25 grams on its own. Most people eating a traditional Asian diet with multiple servings of animal protein per day are consuming 2 to 3 times the recommended amount without realizing it. The research behind this is among the most robust in nephrology. The MDRD study, one of the largest clinical trials on kidney disease management conducted by the National Institutes of Health, followed over 800 patients with GFR between 13 and 55 for several years. Patients assigned to the very low protein group of 0.28 grams per kilogram per day, supplemented with essential amino acid keto analogs, showed a significantly slower rate of GFR decline compared to the standard diet group. More directly relevant to late-stage patients, a meta-analysis published in the Journal of the American Society of Nephrology analyzed 17 randomized controlled trials and concluded that a low-protein diet reduced the risk of reaching end-stage renal disease or death by 32% in non-diabetic CKD patients. In practical terms, the transition to a low-protein diet requires shifting the center of every meal away from meat and toward plant-based carbohydrates and fats. White rice, pasta, cassava, sweet potato, and vegetable-based dishes become the foundation. Small portions of high-quality proteins such as egg whites or a modest amount of fish can still be included. Processed foods must be read carefully because they often contain hidden protein from soy or dairy additives. Timing matters as well. Spreading your protein intake across 2 or 3 small servings throughout the day places less acute stress on your kidneys than consuming it all in one large meal. A single large serving of meat creates a sharp spike in urea production, whereas smaller distributed portions allow a more manageable filtration load. For stage 4 and stage 5 patients, this single change, when applied consistently over months, has shown the ability to delay dialysis by 1 to 3 years according to data from the Cochrane Collaboration Systematic Review published in 2020. That is not a minor benefit. For an elderly patient, years of preserved kidney function mean years of independence, quality of life, and time with family. You now have all 5 tools in your hands. Used together, consistently and correctly, they represent the most evidence-supported natural approach to protecting what is left of your kidney function. You have just seen 5 real, evidence-backed steps that can genuinely change the direction of your kidney health. Danshen to protect your vessels. Spirulina to stop protein leakage. Eliminating the root causes. Acacia Fiber to intercept toxins before they reach your blood. And a low-protein diet to reduce the burden on your kidneys every single day. None of these require expensive procedures. They require consistency. Start with one step this week. Drop your creatinine number in the comments and let me know where you are starting from. I will see you in the next video. Take care of yourself.